We are now approximately 2 months from a fairly extensive procedure. This included a decompression of the common peroneal nerve, the decompression of the superficial peroneal nerve, and the deep peroneal nerve on the top of the foot, as well as the sural branches here. These are actually healing quite nicely. It's been about 2 months. And can you explain to us what symptoms you were having, how long you had them, and what they were sort of keeping you from doing?
Yeah, so my symptoms were severe calf cramping in the lateral side, right underneath that common peroneal scar. I had no sensation in the bottom outside of my foot. I was starting to get motor function deficits. Like I wasn't able to spread my toes.
What about lift your foot up?
And lifting my foot was the last thing to go. So I actually broke my bottom of my toe trying to go up a stair right before I had the surgery. It's been going on for 6 years, getting progressively worse. Used to be just activity induced, then became part of daily life.
So the symptoms, as far as weakness and pain, weakness in lifting the foot, weakness in lifting the toes, pain radiating from the knee to the top and side of your foot for the most part. But did it also go up your calf and up in the thigh?
Yeah, so it started to spread up into my thigh, into my buttocks, and into my low back and deep ab muscle. The psoas muscle was actually really angry, and that was what really kind of put me like incapacitated. I couldn't go to work. I was out of work for a month just laying on my back because the gait problem had just extended all the way up my leg.
And how did this actually start?
I was playing soccer in October of 2015, so 6 years ago.
6 years ago.
Yep, I fractured my tibial plateau.
Which, for those who don't understand, is basically this part of her knee right here, or her leg.
And my first complaint was that I couldn't feel the outside of my foot. My toes were tingling, but nobody connected that to nerves until I walked into here and somebody finally believed me that I had nerve problems.
So for those listening, when she fractured this tibial plateau, you can imagine that a healthy young woman who's playing soccer fracturing this bone had at least a significant injury. And what we hypothesized is that she had a type of stretch traction injury where she forcibly hyperextended her knee, therefore putting these nerves on incredible tension down the leg. This also can happen with ankle sprains when you bring your leg inward like this. You can actually sprain that ankle pretty badly and put a stretch traction on these, as well as the back of the leg with the sural nerves back here. And so we had seen her. We had some EMG evidence of some abnormalities, asymmetry, and we did some nerve blocks to make sure that we truly understood the distribution of her pain. And then we operated, and we're 2 months out. So tell me how you're feeling. Compared to where you were before surgery, how are you now?
Phenomenal, like 90+% better in all the aspects we discussed beforehand. The in between the toes, which were cramping really badly, pain has gone away. All of this cramping has gone away. I have full motor control over all of my toes, and my foot lifts when I tell it to, and I'm sleeping through the night again because my pain has significantly decreased all the way up the leg. All of this has now gone away as well.
So all that pseudo-sciatica symptoms is gone.
Yep, has left my body, thank goodness.
Fantastic.
Yeah.
So would you consider this a fairly successful procedure?
Very successful procedure.
All right, very good. Thank you.
Yeah, of course. Thank you.